This is actually CAR-T cell therapy for patients with relapsed refractory AML and HMA failure myelodysplastic syndrome. These patients are expected to have poor survival. Their median survival is 6 months, and actually even less than that in some reports. So there is a big unmet need for therapies for these patients because most of them unfortunately don't have any viable therapy available that can put them in remission and more so cure them from their disease. So this product is manufactured rather fast. It is actually to express CD33-CAR and membrane-bound IL-15 that helps with proliferation of the cells in vivo. There is no ex vivo expansion of these cells. And there is also kill switch. So we can infuse the cells like day after when gene insertion is happening, so which is very helpful for AML patients since they can progress rather soon. So in this study, we examined 2 cohorts. Without lymphodepletion and with lymphodepletion, we had better expansion in lymphodepletion cohort, and some of the cells existed up to 7 months following the infusion in patients. What we identified, the dose actually that was the dose level 3 in this study in lymphodepletion was well tolerated, and that was defined to be the dose to go on expansion phase. We saw objective responses in relapsed refractory AML patients, with 30% of these patients having responses and 2 of the patients having complete remission, and 1 of them going into allogeneic stem cell transplant and still being alive at this point of time.